Okay, so we have here the objects that most likely being confused here with the RBC. So the first one we have here the yeast cells. Yeast cells here is just your fungi. So basically they are pang spores lang siya. So they are identified here by they are able to form here buds. Pag sinabing buds, meron siyang parent cell, may daughter cells here na they are about to detach but they are still attached to the mother cells. So you call it once your budding process. On the other hand, we have also here your oil droplets, and we have also here your oil droplets and air bubbles. So those are highly refractile substances. So if you try to manipulate your fine adjustment knob, they tend to form here highly refractile substance. Your RBC is not refractile. Another one, WBC. So some of your WBC, some of your RBC which are crenated. So they appears to be like para siyang granules ni WBC and sometimes they could be mistaken as your WBC. So the best way to identify those substances here as not your RBC is by addition of your acetic acid. So acetic acid would lyse the red blood cells but not your other objects or other structures. Okay, so therefore, that would identify your RBC. So, pag nag-add ka ng acetic acid, pag nawala siya, so that's your RBC. Pero pag doon pa din siya after addition of your acetic acid, so mean to say it's not your RBC. Okay, now we go with your WBC. Okay, so white blood cells here much larger compared with our red blood cells. Okay, and they are multinucleated. Meron siyang lobes, multilobulated. Meron siyang nucleus. Compared with the RBC na wala siyang nucleus. So the most likely na WBC that's been seen under the microscope in your urine sample would be your neutrophil. So in dilute alkaline urine, your neutrophil try to lyse and begin to um, eventually lose your nuclear details. In the case of your hypotonic naman na solution, it try to absorb the water, it try to swell and lyse. And the granules within that one show here para siyang Brownian movement with the characteristic na sparkling appearance. And therefore, we refer that neutrophil here to your glitter cells. Identifying here your glitter cells with the usual na neutrophil lang. So again, nagiging glitter lang siya once it's being exposed here to your hypotonic solution. So you could use here your Sternheimer-Malvin stain. Okay, where the glitter cells will be stained here as blue na color, whereas your usual na neutrophil would have here na violet na color. So another one, WBC could be seen here under your urine sample under the microscope would be your eosinophils. Okay, eosinophils most likely associated here with your allergic reaction. In the case of your drug-induced interstitial nephritis, it's just allergic reaction with drug administration. I mean to say, nag-take siya ng drug, nagkaroon ng allergic reaction, and therefore able to see here your eosinophils under your microscope with a urine sample. Eosinophil could also be found here in some urinary tract infection and the early stage of your renal transplant rejection. Okay, so identify your eosinophils, then you could perform here your stain. Okay, ulit ang stain natin for that your Hansel stain. So all you need to do is just have your dried smear prepared by cytocentrifugation or by centrifugation. Okay, and then try to stain with the Hansel. Okay, and then try to count here 100 to 500 of your 100 to 500 of your WBC, and then identify how many are of that are your eosinophils. So parang number of eosinophils per 100 times 100, that gives you a percentage. Or over 500, so 500 goes to my count, that over 500 times 100, that gives you the percentage of the eosinophil. And usually, eosinophils is not usually found within our urine sample. Okay, and the percentage of more than 1% na eosinophil count is already considered as significant. We have also here the mononuclear cells. Mononuclear cells are, wala silang, they have only the nucleus na round. So that includes your lymphocytes and other cells here. Lymphocytes, for example here, your RBC, because maliit din ito, it would have the same size as the RBC. Lymphocytes usually could be found here in the early stages of the renal transplant rejection. Monocytes, macrophages, histiocytes contains the vacuoles and inclusions. And usually they are not found in the urine sample. And once they are present in a very high concentration, it would signify some They're related here to malignancy or metastatic cancer. That's why you need to refer here for cytologic analysis for that. Okay, increased WBC in the urine. You term that one as your pyuria or pus cells. Pyo is pus. Your WBC is your pus cells. Okay, and that might be also here because of your bacterial infections related to your cystitis, pyelonephritis, prostatitis is the infection of prostate gland, urethritis is your urethra. Cystitis is the lower genitourinary tract infection. Sa taas ang ating pyelonephritis. So like, di ba, lower is your urethra, mga bladder, ureter, that's your cystitis. Pag umakyat siya pataas sa kidney natin, renal pelvis, nasa renal tubules na natin, that become your pyelonephritis. In some other occasion, in non-bacterial infection naman, although they are not bacterial infection, the patient also try to produce here pus cells. Okay, so madami pa rin siyang WBC. Just in the case, for example, of your SLE, systemic lupus, erythematosus, glomerulonephritis, acute interstitial nephritis, like in the case of your eosinophil, and okay, so that's it for your WBC.